I don't really like the word can't sometimes. You know, we don't live the whole can't word in our cancer world. I didn't. And then it was always I can, I will. And afterwards, some things creep in your mind where, you know, you can't do this. And that's what I would say to myself, where did this word can't come from? Never used it in my whole entire treatment. And now it's coming out now. I got to get rid of it. How do I step over that barrier of these limitations? I'm Lindsay Lenny, and I was diagnosed when I was 29 of acute lymphoblastic leukemia. So I had 2 rounds of chemotherapy, a stem cell transplant, full body radiation, and then I had spinal-tap radiation as well. I was diagnosed in April, so 3 months in the hospital. The isolation started right away. I felt completely alone because I'm by myself. It's scary. You don't know what's happening. All you know is you've got cancer or you're close to death. Just trying to focus on that. And then it was moving to the new ward, being isolated from everybody. Your door is shut. People come in with gloves and masks on. So you have the physical barriers too that you can't really interact. So you're feeling like you're the creature, you know, or the ETs, you know. So it was a little bit difficult. We weren't allowed to associate or talk with other patients on the wards. Because we're so sick, one person can carry an infection, another one can't. And because we have no immune system, they wipe your immune system so you can't fight even a common cold. But I could not help myself. I'm such a social person. My family made contact and built relationships with other families on the ward. So that kind of helped me. They were like, okay, this person's here, you know, they're this kind of an age. So I met one of them and we became really good friends. We were able just to kind of connect and go, oh, I'm glad you're feeling this. This is what I'm doing. You know, doesn't this suck? And kind of just bring some humor around it and just be able to just sit with each other and just understand that we didn't even have to talk. We just being with somebody else was just so much better than not having anybody there. I lost a lot of friends. They got to move on with their lives. So they were there right at the beginning. How, you know, this is awful, this is happening, here's your get well cards, you know, and then it was just no contact after that. And sometimes the people I thought would stick around didn't. And the ones that I hadn't talked to before or for a long time came forward and really stepped up and were there for me, that I could totally count on, that I least expected. So that was a bit of a surprise. And I think it really brought out an understanding that, yeah, people are real. A lot of people can't handle some of the things that I'm going through or watching their friends do that. And that was okay. It was still hard for me to lose some friends. I had one that was completely honest with me and said, you know, I can't come and see you. I can't handle the fact that you are sick. I don't know how to talk to you, and I just can't do it. And I didn't talk to her for almost over a year. And she's like, I'm sorry that I had to. I'm like, you know what, that's okay. The big thing was like people saying to me, I don't know, we don't know what to talk to you about. Well, just talk to me normally. What's going on in your life? You know, like, I want the gossip. Give me the goods. Like, I'm stuck in here. I know life's continuing out there, you know. Give me something to focus on or talk about. It doesn't have to be about my cancer all the time. You know, this is just where I'm at right now. People are going to look at you no matter what. And I just have to make sure that, you know what, you know who you are. Stay confident in who you are. This is the journey. They have no idea the fight that you have just gone through. Be proud of you being here, standing here, and showing yourself. Be proud that, you know what, I fought this battle. I fought this cancer so hard. I deserve to be here. look at me all you want to. It's been a little bit hard now with my hair the way it is. This is like 4-year growth. So it's so much finer. It's like little baby hair. I joke around a lot. That's just my bone. I'm like, oh, I just love your hair. Or I see other people who have gone through the same, and their hair is thick and beautiful. And I'm just like, oh, I'm so jealous. That's just not fair. So, but it's just something that, now is that's just who I am. I just have to keep plugging along, and self-image is always something you got to work on. And I just say, you know what, this is who I am. I have to accept me for me. Getting back into the workforce, getting back into a normal life, or trying to find that new normal, I didn't know what was going to happen. I was such a professional, always wanting to work type of person. Liked my own independence, having my own kind of career goal set. That future was still in my mind, but my body and cancer diagnosis wouldn't let me go forward with it. So there was a lot of losses. It's a lot of losses that you don't think about, that you have to grieve through each one. So getting to that point and then going, okay, getting stir crazy at home, I'm getting better, I'm getting out in the world, maybe I can think about doing some things. And then I found out about the Leukemia Lymphoma Society. So and then I just started volunteering, and they had no support groups set up yet. They were just starting. So I worked with their patient service manager and helped her start, and I'm the ambassador of a support group, the leukemia group. And then they have more now. So that's what I just started doing, volunteering for them. Working with them as much as I could in the office, because that's what I could do. At least I could volunteer and feel like I'm contributing. For me, I think it's always there. And maybe because they're like, you got to hit the 5-year mark, and I haven't hit the 5-year mark yet, but even if after, it can still reoccur. So I think it's always in the back of my mind. I'm always extra cautious. Always the thoughts of, you know what, okay, what if I relapse? What will I do for treatment? The choice of, do I do treatment again or do I not? Do I really want to go through it all over again? I don't know. So end of life has been a big issue. I've prepared myself for that. I don't want the burden of that to be on my family. So I planned and I've paid for my funeral costs, have my will done, so that it's just taken care of for them. I know for me, I'm not afraid of the dying, I'm afraid of the saying goodbye. And I would rather them just pick up a phone and say, you know what, have the nurses do it, and it's just taken care of. And that's a reality, unfortunately, but that's just a reality that I had to make sure that I thought about. And I know now that if I relapse or if anything happens, that stuff is taken care of. So those logistics, that's the little bit of part about control, right? Because you lose so much control. These are the little things that you can take control of. And just kind of, having the attitude, well, you know what, I've done it, I'm still fighting, and I'm going to continue to fight. Whatever comes up next, comes up next. People are like, Lindsay, you've got too much cancer stuff going on. It's all around you. And I'm just like, yeah, and then I think, no, but that's who I am. Like, that really defined who I am. This is maybe why I've gotten this cancer. I don't know. There's the big, huge question of why. But I know that I have to turn it into, this is what's happened. This is my experience. How can I help others? And that means in the future, bringing, awareness, like helping other people, knowing that they're not alone in their experience, being able to say, you know what, I've been there, I've done it, I'm here, giving them hope that to other people. So I don't think I could ever now pull myself out of that whole cancer world. It is who I am. I've totally accepted that, and now it's just incorporating it in my life in a healthy way.